Athanasius Afful, a researcher from the Global Health Solidarity Project. Athanasius is based at the University of Ghana, and he will present findings from the 2 workshops we held in Africa, which were in Guinea and Ghana. Athanasius, you have 10 minutes. Over to you.
Thanks, Julian. And good morning, good afternoon, good evening to everybody where you are. And thank you for making time to join us in this conversation. So like Julian mentioned, we have been organized already 2 engagement workshops, one in Accra, the other one in Conakry. And what we did at these workshops was to bring people together from different backgrounds with different expertise in different disciplines to sit with us and to talk to us about solidarity and to share with us from their lived experiences what solidarity could mean in practice. The Accra workshop was more conceptual because we tried to tease out what solidarity could be, what solidarity could mean, and how we can disambiguate solidarity from other practices and expressions that look like solidarity but may not necessarily be solidarity. On the other hand, the Conakry workshop focused more on the internal workings of solidarity, what modes there could be of solidarity, what moods and what feelings energize solidarity, and what values are at play when solidarity is enacted. And in as much as we made some interesting findings from these workshops, some burning questions also emerged from these workshops, and we are engaging broadly with other participants in other fora to help us address some of these questions. I remember, for instance, we shared these questions with participants at the Ethos Conference. So I'll just dive into sharing the findings, some of the findings we made, starting with the findings from the Accra workshop. So one theme which stood out clearly at the Accra workshop is the understanding that solidarity is a way of life. It is more lived than it is theorized. And in fact, people live and practice solidarity even without thinking about it as solidarity. And because it is a way of life, people are just socialized into it. So from living with people in homes, in communities, people just learn that they must support other people, they must cooperate, and they must offer assistance to people when they need assistance. So it's just a way of life. And the justification for this particular understanding of solidarity could be, like it was mentioned at the workshop, the African relational understandings of personhood and what it means to be a person. So we are so intrinsically interconnected. And one way of realizing our humanity or reaching full humanness is to be of help to others, to support others, to offer help, to be pro-social. So solidarity is a way of life, but it's also a way of being human, a way of attaining full humanness. Other conversations at the workshop focused on drawing the nuances between solidarity and other related concepts such as cooperation, reciprocity, and altruism. And it was indicated that although cooperation, which sometimes requires reciprocity, is an important aspect in solidarity, it does not necessarily constitute a necessary condition for defining solidarity. Because in some of the examples that were cited of some cooperative practices, it emerged that people can be excluded from the cooperative, but not necessarily from the solidarity which grounds the cooperative. And this thought was actually validated by one of the case studies that was shared at the workshop. So somebody had been kicked out of the cooperative because they had demonstrated antisocial behavior, and this person was in prison. But the very people that had kicked this person out of the cooperative went to work on this person's farm because they realized that the planting season was fast approaching, and because this person was in prison, she wouldn't be able to work on her farm. So they excluded her from the cooperative, but they could not exclude her from the solidarity itself. I would dive now into some of the salient findings we made at the Francophone Conakry workshop. The workshop in Guinea highlighted the importance of feelings and motivations in the practice and the enactment of solidarity. And it was clear that solidarity draws a lot of energy from such feelings and motivations as love, compassion, empathy, trust, respect. And because of the bond between solidarity and these feelings or motivations, solidarity can be described as an example of humanism or an example of good human behavior. It was also indicated that if solidarity is to be meaningful, then it must be offered and rendered in a manner that is respectful of those who receive the solidaristic help or act. And to be respectful, solidarity must be offered in a timely manner. It must be offered to those who need it at the time when they need it. And timely response, therefore, is also an expression of respect. And it is the timeliness, it is the respect that makes a difference between whether those who are receiving solidaristic help are being treated as equals or they are being treated as people who are just at the receiving end of some charity. I'll conclude this presentation of findings by sharing with you a word of caution that was shared with us in our engagement with our participants. Since it is our aim to unpack solidarity and ultimately apply it to global health to cause the kind of change we want to see in global health, we are cautioned that we should be careful about how solidarity is used, because solidarity could easily become a romanticized concept. People could appeal to it, they could use it for make calls for international and national solidarity without any real concern or commitment to transformation or change. And this is one thing that came up clearly during the COVID pandemic era. So if it is our aim to unpack and apply, then we should already start thinking about and exploring ways of applying solidarity in a way that will cause people to take it seriously. Thank you very much.
Athanasius, thank you very much for the wonderful presentation and the summary.